So the muscles, again, one more time here, would be the the cricothyroid muscle here, connecting the cricoid to the thyroid cartilage, and then you'll have the thyrohyoid muscle connecting the thyroid cartilage to the hyoid bone, and you would have the the sternothyroid cartilage coming down, connecting the thyroid cartilage to the sternum. Okay, then you have the omohyoid, which again is going to pass the superior belly, and then about here then it will become the inferior belly, so there will be narrowing. Okay, and you will have your sternohyoid muscle, the most superficial one in this area, coming all the way down to the sternum. Okay, so here's your muscles in lateral view. That's omohyoid, that's sternohyoid. So all those muscles just described are also known as the infrahyoid muscles. They're below the hyoid bone, and their role is to depress and to lower the hyoid bone, such as after you swallow, the hyoid bone, the larynx goes up and then it goes down, so those muscles help pull it down. Okay, so those were all infrahyoid muscles. Now there's also a set of muscles that are supra to the hyoid bone, so suprahyoid muscles, and first one is the mylohyoid muscle. So it comes from the front of the hyoid bone and attaches to the inside of the mandible. So there's your mandible, and attached to the inside of the mandible. Next is a muscle called the stylohyoid muscle. So remember, there's a styloid process at the base of the skull, and from that styloid process comes a stylohyoid muscle. Stylohyoid muscle goes from the styloid process to the hyoid bone, stylohyoid. Also another muscle coming from the styloid process is called styloglossal muscle. It will go to the tongue, so I will show you that when we talk about the tongue. So stylohyoid, styloglossus, mylohyoid. Then there's a muscle called the hyoglossus. So from the hyoid bone to the tongue, hyoglossus, it goes straight up, so like so. Okay, so I'll show you that more clearly later. So mylohyoid, stylohyoid, styloglossus, and then there's a hyoglossus muscle along the back. And finally there's a muscle called digastric. It consists of an anterior belly right under your right on top, two of them, right on top of the mylohyoid. The anterior belly then goes through this little facial sling and comes out from the back and attaches to the mastoid bone here, like that. So this here is the posterior belly of digastric. Goes through that little ligament there that holds that is attached to the hyoid bone, and comes out through the other side and is called the anterior belly, and attaches also to the lower part of the mandible. So this anterior belly is used to lower the jaw, hence opening the mouth. The posterior belly, when it contracts, it pulls the hyoid bone up.